can see those two little kind of like cauliflower ears on the heart, and those are the auricles. You can see grooves that are going basically either vertically or horizontally, maybe a little more obvious on this side, horizontally, vertically. The horizontal ones would be the atrioventricular groove, and the vertical one would be the interventricular groove between the ventricles. Now remember that if you're looking at the cut surface of the heart, you should always be able to tell which side is left and which side is right, because the left side is going to have that thicker muscle and the right side is going to have a thinner muscle. I don't believe I ask any questions where you should be telling me necessarily left ventricle or right ventricle or something of that nature, but remember that there are some structures that are only going to appear on the left or the right. In particular, these openings of those major veins that are bringing the blood back into the right atrium. You would not see those on the left atrium. Before we get to that, remember that the chambers inside the heart are the atria and the ventricles. You can see them separated by the flaps of the AV valves here. So dorsal to this AV valve would be an atrium. Dorsal to this AV valve, again, an atrium, left in that case. And ventral to the AV valves would be where you would find your ventricles. So if we look into the right atrium, we can find three openings. This one is the opening of the anterior or cranial vena cava. This one is the opening into the posterior or caudal vena cava. And the third opening here is the opening from the coronary sinus, all three returning blood to the heart. And we went over that in lecture as well as in lab. So this would be your right AV valve, so that's your tricuspid valve. This is your left AV valve, that would be your mitral valve. And remember that we have these little cord-like structures attached to the valve flaps on either side. Those would be the chordae tendineae, and they're attached to the valve on one side, but remember on the other end, they are attached to these little mounds of heart muscle tissue that are called the papillary muscles. And then this heart actually gives you a fairly good view of those kind of ridges and valleys here that are formed by the muscle that are called the trabeculae carni. And again, if you look inside here closely enough, you can see those ridges and valleys that are the trabeculae carni. This area of the heart muscle would be the interventricular septum, basically a septum, a wall between the ventricles. Remember to say interventricular because that tells you it's in between. Don't write intraventricular septum. That has a different meaning and you would not get full credit. So make sure your penmanship is good too, so that I can tell what you've written. Let me see if I've left anything on.